So great to be with you again. Thanks for joining us here and making us part of your Saturday morning. Medications are really a marvel, and they've really changed our lives in so many different ways. When you think about prescription medications, think about it. At some point during the day today, chances are, if you haven't already, you're going to pop a pill or maybe two or more. And as you do that year after year after year, one of the unintended consequences of that is something called drug nutrient depletions. All those medications we take can have impact that you may not be aware of and that kind of sneak up on you over time. So, of course, when we're talking about medications, who would I turn to other than Gregg Russell, pharmacist, clinical nutritionist, and the founder of Fort Wayne Custom RX. Good morning.
Good morning, Lee. Merry Christmas.
Same to you. Yeah, all of that.
We'll talk about a good way to start thinking about our New Year's health.
I think it's time that we do, and you brought me a case study that I am fascinated by this. So this is a 77-year-old retired fireman, and it's a perfect example of how medications kind of layer and layer and layer, and suddenly there are consequences we didn't think about. So let's walk through this.
Sure. Well, I'll tell you, this topic that we're going to talk about today, I think is probably the most important topic that we've talked about, over the course of this last year. And so for anybody listening, if you have friends, make sure they download this podcast or go out to your site so they can watch this, because I think this affects a large population of people, and many of them are probably WOWO listeners. So where I'm really interested in this is of course, the names have been changed to protect the innocent, okay? Right. As well as, when I'm not advocating, I'll be very clear up top, is for you to stop taking your prescription medications. But I think we need to be aware of what could happen over time and why you need to really look at those prescription medications and talk about nutrient depletions before you start experiencing them. So this person that we're going to give a case is fictional. However, it's very representative of what I see day in and day out at the pharmacy. When people come in and ask me one question, I ask them 2 or 3 follow-up questions. All of a sudden, the whole ball kind of unravels, and we see a scenario where we don't have an easy answer, but one that we need to investigate and treat properly. So in this case, we have Mr. Smith. We'll call him Mr. Smith. He's a 77-year-old white male firefighter. Okay, so he's a retired firefighter. So he's probably been exposed to some different things over the course that you and I wouldn't be exposed to, chemicals.
Yeah.
And so whether it's a firefighter or whether it's somebody who's worked in industry, in a factory, or has been exposed to chemical toxins, there should be kind of an alarm level that as he's aging, he might have some of those further health consequences that may occur. And he basically comes in and says, hey, I want to start a multiple vitamin. And we would ask him, well, what do you want that multiple vitamin to do for you? How can that help you? And many times they'll tell us a little bit more. In this case, he says, hey, I'm experiencing a lot of fatigue and I'm having some muscle cramps. So then we start saying, well, there are certain drugs that may cause muscle cramps. So let's find out a little bit more. And so when we start finding out, we find out that he has had a 50-year plus smoking history. So he smoked as well as was a fireman. Now he stopped smoking because he had a heart attack the year before, and that left some damage. He had a little bit of what we call heart failure. And because of that, he was put on some drugs for that. Many of them are very common: Lasix, hydrochlorothiazide, and a beta blocker called metoprolol. And we'll talk a little bit more about those drugs in a few moments. And then he was also, because he had a heart issue, he was started on a statin drug, Lipitor. And then, of course, he now has high blood pressure, so they put him on another drug called captopril. And before that, he had a 15-year history of being diabetic. So with the diabetes, he was on Metformin. And because of some of his diabetes and some of those symptoms, he has some reflux disease, and he's been taking over-the-counter Prilosec. And for his aches and pains, he takes over-the-counter Aleve. And so, as you can see, this gentleman is taking a lot of different things. And so to answer that question, what's I want a multiple vitamin to help me with fatigue, it's going to be a much more deep, involved conversation we're going to have.
Interesting. And so, again, as I often will tell people, that's one of the reasons that guys like you are so important in the healthcare world. You're not one of those big corporate pharmacists who sit behind the glass and have extremely high volumes all day long. Your mission is to work with people and walk them through problems like this.
That's right, correct.
So we're going to talk a little bit about consultations in just a second, but let's walk this backwards.
Sure.
So this guy comes in with all of this stuff going on. How do you take that apart and find out exactly what he might be nutrient deficient in?
Well, sure. So what we start doing is we start looking at each one of those type of medications, and we start looking at what the studies show, which type of nutrients would be the most deficient. And then we start looking for commonalities. We start looking to say, hey, if there are 2 or 3 different medications, and by the way, the studies show that people that take 3 or more medications for years start to develop these nutrient depletions. And as we age, they become more intense. So as I'm sitting here and I'm looking at this gentleman, I'm starting to think, well, if he has certain nutrient depletions, which I've already zeroed in on, what is that going to potentially affect him long-term down the road in the next 5-10 years? He's going to now start coming in for another health issue that we might have been able to prevent if we were just taking care of his nutrient depletions at that time.
And the cure for that is it a vitamin? Is it minerals? What are we replacing that the drugs are taking away?
And that's what's going to be very unique to every single individual. So if we just take a look at that drug that he's taken, that OTC Prilosec. Now, when we delved in a little deeper, we found out he wasn't taking the over-the-counter Prilosec for 2 weeks like that drug is labeled for. Mm-hmm. He's been taking it for years, and he's actually taking double the dose because he realized that if he got it on prescription, he could save him money if he bought over the counter and doubled the dose. So he's really taking a prescription strength dose, and he's been taking it for years. So what does that type of drug do?
Well, Prilosec's a protein pump inhibitor, and it reduces the amount of acid that your body produces, right?
That's correct. And as a result of that, it turns off the pumps in the stomach that secrete acid. And as a result of that acid then, and it's great if you have an ulcer. These are fabulous drugs for ulcers, and they're used for GERD. However, unless you're taken under a doctor's care, they have long-term consequences. And one of the big long-term consequences that we see is because that drop in that acid, we have a harder time starting to break apart the vitamins and minerals that are in our foods. And the big ones that we look at is magnesium, calcium, B12, and zinc. Boy, we've talked about zinc a lot in the last few weeks, haven't we?
Sure have.
The last few shows, yeah.
Exactly.
So, this person might be at risk for having low zinc levels. So when we start looking at that, we say, oh gosh, here is a guy that, when I start thinking about magnesium and calcium, I start thinking immediately of bone health. Mm-hmm. I start thinking about the heart. Magnesium, when I used to work in hospitals, when people come back from surgery, we used to give them a giant magnesium drip because it helps stabilize the rhythm in their heart. So magnesium is very important for nerve conduction.
It's a vasodilator also, right?
That's correct. It helps.
Yeah, helps.
It will help with some of the blood pressure control issues too. Mm-hmm. So you have just that one drug has a problem. And then also, if I look and I'm saying, oh gosh, he's also on a leave. Well, leave might be actually exacerbating or making his GERD worse. And again, why is he on a leave? Because he's got pain and inflammation that's not been diagnosed or treated. But then also, he has some heart failure, and Aleve is the last drug you want to be on if you have heart failure. So again, is there a miscommunication between him? That the doctor probably did tell him, don't take ibuprofen, don't take this, don't take this, and he's gotten confused as to what that drug is or forgotten it.
Sure, yeah. Mm-hmm. Wow, that's a great example. So that's where we're going to take the rest of the program. Then we're going to walk through some of the medications and conditions that are likely to result in the potential for some of this nutrient depletion and what you can do about it. What's the smart thing to do? And we'll get into all of that as we continue here with Gregg Russell, pharmacist from Fort Wayne Custom RX on the HealthCall Live Radio Hour on WOWO. And I am here with Gregg Russell, pharmacist and clinical nutritionist, founder of Fort Wayne Custom RX. We are talking about drug nutrient depletions, how over time the medications you take can rob your body of vitamins and minerals and the consequences that can have. We started the program with the discussion of a patient, a case study, 77-year-old guy taking 7 different medications. And Greg, I was shocked. You told me that actually might be low for somebody that's age 77.
Yeah, might be. Yeah, there's definitely reports in the literature from geriatric pharmacists that the average patient takes well over 12 meds in geriatric medicine.
Wow, that's shocking to me. Okay, so one of the things we were talking about was Prilosec, or protein pump inhibitors for gastric reflux this guy was taking. And so what do you do about that? We discussed that it reduces the acid in your stomach, so you might be set up for a B12 deficiency. And what would be some of the signs of B12 deficiency?
So again, there's part of the fatigue. Now, again, we have to step back and say, congestive heart failure will cause some fatigue too. So, these are not, it's a multiple of things that have to be done, but I think these get ignored. And so, again, B12 deficiency plays a very important role in allowing us to make red blood cells. It plays a very important role in the citric acid cycle, when we were trying to talk about demethylation and methylation, where we're trying to get our homocysteine levels down, which there's a correlation to heart disease and homocysteine by having low B12 and folic acid, and that's a whole show in itself. So, but generally, what's interesting about B vitamin deficiencies, they're well documented. They're easy to treat, and basically, you just take a B complex or a good multiple vitamin with complete Bs.
So some of the other meds he was taking can result in a magnesium deficiency. Right. Magnesium, as you said, is so important in so many different ways.
Absolutely.
What are some of the symptoms of a magnesium deficiency?
So again, the magnesium, a lot of times we see magnesium having... people that are low in magnesium tend to have a lot more cramping. They'll also have some fatigue. So an example I always tell people is magnesium is what we call part of the enzymes, making your enzymes work. It's what we call a cofactor. So magnesium is involved in 300 different type of chemical enzymatic reactions in your body. And an example of that would be if I was going to make spaghetti. I'd take spaghetti and I could do it two different ways. I could take a pan of boiling water and turn it up, and over time, that water, the temperature of the water would make that water boil. I throw the spaghetti in, I make my spaghetti. However, if I want to move the process along a little quicker, I throw a coenzyme in there, and in this illustration, we put salt in there, right?
Sure.
Salt lowers the boiling point, allows that water to boil more quickly. That's what magnesium does. Magnesium and other coenzymes, which are minerals and vitamins, are important to move those chemical processes. So I'm a diabetic. I have diabetes. So this patient has diabetes. Diabetes tend to burn a lot of magnesium. I'm an athlete. I'm working out 2 hours a day. I'm a high school athlete, a college athlete. I'm getting cramps at night because I'm depleting my magnesium, because I need that magnesium to help that process move through. And so magnesium is considered one of the... It's kind of the wicked stepchild that's forgotten, the Cinderella of nutrients, because we all think about calcium. We forget about magnesium. Magnesium is so important for our bone and our nervous system, too.
So if you're taking a statin, you might be depleting your body of several things, and so you might turn to something called CoQ10. Tell me more about that.
Well, CoQ10, we've talked about in past shows. CoQ10 is really important because CoQ10 is what I tell is kind of like antifreeze for your car. Okay, it keeps the mitochondria. So you have these little energy centers in your cells. Every cell has them, called mitochondria. And the cells that work 24/7 all the time, that'd be the heart, the liver, the brain. You're not running those things. They have to run by themselves. The mitochondria makes this thing called ATP. ATP is your energy source. Okay, so as we age, we get less mitochondria, inherent of aging. But we want the mitochondria we have to work as well as it can. And so we need the coenzyme Q10. So in the process, coenzyme Q10 is related to vitamin K, and coenzyme Q10 is also involved in the cholesterol process. So when I give a statin drug, I am blocking the production of cholesterol. When I block the production of cholesterol, then coenzyme Q10 is also blocked. So on one hand, I'm trying to do something that's going to prevent myself from furthering of heart disease. On the other hand, I'm diminishing the potential antioxidant benefit of that coenzyme Q10. And coenzyme Q10 is one of the few antioxidants that actually works in the mitochondria. So again, what we simply do on that case is we give coenzyme Q10, replace it. Coenzyme Q10 has been shown in studies to benefit heart failure patients. It's been shown, along with magnesium, to help lower and control blood pressure.
Excellent. So let's talk about blood pressure. So many people are on blood pressure medications. Right. What are some of the unintended consequences of those?
Sure. Well, the two that are most commonly used, are ACE inhibitors. And the reason why they're commonly used is they are very low side effects. When I was in pharmacy school back in the moon age, okay, back in the early 80s, we had less blood pressure medications, and we call high blood pressure the silent killer because people didn't like to take the medications because it made them feel pretty cruddy.
Yeah.
Well, ACE inhibitors and calcium channel blockers and some of those drugs have replaced the beta blockers, even though this patient's on a beta blocker, as some of the drugs of choice for blood pressure. But as a result of that, they do have some unintended consequences. And ACE inhibitors have a tendency to drop our zinc, deplete zinc, and captopril is one of the worst. And so we want to monitor zinc levels. Also, on the opposite effect, ACE inhibitors can also increase our potassium levels. So we do want to monitor, your doctor's going to be monitoring your potassium. Why not monitor your zinc also?
Sure.
Yeah.
And then we're running a little tight on time.
Sure.
Which one of these do you think is most important that we mention next?
So probably metformin. Metformin is widely used by everybody. So again, we know metformin causes a B12 deficiency over a long period of time, especially when people have been on it for years. There are studies that show after 6 to 12 months, it starts to affect homocysteine. Homocysteine is related to B12 and the fact that if your B12 drops, your homocysteine goes up. Homocysteine is highly associated with heart disease and Alzheimer's disease. So again, simple replacement of B12 kind of helps take that. Also, metformin can cause some peripheral neuropathies, which B12 will do if it's so. Again, we want to try to prevent those issues.
So people, I don't think, are accustomed these days to having an in-depth conversation with a pharmacist.
Probably not.
You make that opportunity available with a consultation. So you're going to talk me through all my conditions, all my medications, and then actually put together a little formulation for me and guide me into the right nutrients?
Well, we'll certainly guide you into the right nutrients and give you some cheat sheets. And, we all go into some lifestyle too, because, for example, we know that bone health is improved by exercise, weight-bearing exercises. So, again, a gentleman with congestive heart failure, we may not be able to do that without talking to the doctor. But other people, we want to give some lifestyle tips too. So what's going to happen to this guy down the road if he keeps on the track he's going and doesn't pay attention? He's at risk for osteoporosis. He's at risk for having sleeping disorders. And these things just cascade over time. And so these are the things we're trying to prevent from happening in the future.
Yeah, stop that downward spiral of aging. So if I'm interested in having a detailed conversation with you, what's that process? Is there a cost? How much time is it going to take? How does all that work?
Yeah. So right now we are offering sit-down conversations, consultations. We do them by appointment. So if you call the pharmacy, 260-490-3447, and ask for Paula. She's my nurse. Paula and I, Paula sets my calendar, to be quite frank. I'm pretty bad at it, so she does a great job. And she gathers the information that I need, and then we try to get on it, usually a 20 to 30-minute consultation. We're very low cost, so
great.
Many times it's free.
And you can do that over the phone or via Zoom. I know you can do...
Probably right now we're doing most of it, we would do it either over the phone or Zoom. But I can't tell you how many times people just stop in, we ask 2 or 3 questions, we give them those answers. Not everybody requires a full sit-down consultation. So
if I'm on, is there anything that we all ought to be taking these days? Well, we talked about zinc for prevention of COVID-19. We've talked about vitamin D for the same reason, COVID-19.
Right.
Well, what else are you in favor of?
Well, magnesium's huge. Magnesium's really important. Probiotics really important. Omega fish oils, quality omega fish oils are important. So again, that is going to differ from person to person. But if I was going to pick the top things that I put everybody on, multiple vitamin, for example, a good multiple vitamin everybody should be on. We haven't even talked about younger people like females that might be on birth control pills. Yeah. They are notoriously robbers of folic acid. So here's the scenario. Women take a birth control pill for years, and they decide they're going off the birth control pill, they want to start a family. However, if they've not been taking folic acid in the form of with a multiple vitamin, they don't have to take a large amount. If they haven't been taking that over that period of time, they get pregnant, then they are running a folic acid deficiency, and that is definitely linked to nervous system defects in newborn babies. We want to eliminate that.
Sure.
And that's an easy elimination. So anybody taking a birth control pill should be taking a multiple vitamin, or prenatal would be excellent.
We've got to run. Time is gone. Thank you so much. That is Gregg Russell, pharmacist, clinical nutritionist, and the founder of Fort Wayne Custom RX. You can find them online at fwcustomrx.com.